Go ahead, ma'am.
Yeah, good evening, everyone. I'm Dr. Poornima Mathur. As routine, I'm coming again with another topic to discuss with everyone as part of our series. And today I'm going to talk about how do we understand IVF, because it has been like everybody talks about it, but it is like everybody knows it, yet everybody does not totally understand it. So it is very important कि हम इस IVF के procedure को समझें. When is it indicated? There are many myths surrounding it, what to expect or anticipate in a procedure if you're undergoing an IVF, and how to go about it. So let me start with it. So in IVF, अगर हम देखें the how before we get into IVF is simply जो अंदर naturally होता है, the way nature created. एक baby बनता है अंदर, we are trying to just replicate everything outside the body. So how does a natural pregnancy happen? It is very important that we understand the procedure of a natural pregnancy. So natural pregnancy जब होती है, we need एक egg lady से, एक sperm from the male, and they make the baby. So अगर हम देखें, this is the reproductive system जो एक lady का होता है. Now every month, if you have a regular cycle, एक egg which is called the follicle would start maturing. वो mature होना शुरू होगा, बड़ा होना शुरू होगा. एंड अगर हमारी 30 डेज की साइकिल है, 28 to 30 डेज की, तो अराउंड 14th डे पे मेच्योर होके वो ट्यूब में रिलीज होगा. नाउ ड्यूरिंग दैट पीरियड ऑफ ओवुलेशन, अगर अनप्रोटेक्टेड इंटरकोर्स होता है, दैट इज हम बिना किसी कॉन्ट्रासेप्शन के, कॉन्डम से, पिल्स के हम रिलेशनशिप रखते हैं, तो स्पर्म्स आर डिपॉजिटेड इन दी वजाइना. Now these sperms में motility होती है, वो चल सकते हैं, they can travel upwards. Now these sperms travel upwards in the uterus towards the tubes to meet the egg. And ये वो ट्यूब्स होती है जिसमें आपका एग और स्पर्म मिलके एम्ब्रियो बनाता है. बट ऑब्वियसली हमारा बेबी ग्रो करने के लिए तो हमारे यूट्रस ने मेहनत करके लाइनिंग तैयार करी होती है, एंड दिस वे फॉर 9 months द बेबी सपोज टू ग्रो. सो नाउ दिस एम्ब्रियो नोस कि आई एम नॉट एट माई डेस्टिंग पोजिशन. नाउ ये एम्ब्रियो ग्रेजुअली माइग्रेट करना शुरू करेगा टूवर्ड्स द यूट्राइन कैविटी. बहुत सारे फैक्टर्स होते हैं जो इन चीज़ों को एड करते हैं, बहुत सारे फैक्टर्स हैं जो इनके ट्रांसपोर्ट को इम्पैक्ट करते हैं, लाइक द हेल्थ ऑफ द ट्यूब, सीलियरी मोशन, एनी फ्लूइड, एनी इन्फ्लेमेशन, एवरीथिंग इम्पैक्ट्स इट. इन अ सिंपल लैंग्वेज में अगर हम बोले, ये एम्ब्रियो बन के अपने घर जाने की कोशिश करने के लिए ट्रैवल करता है. द एम्ब्रियो नोज कि मैं 5th डे अपनी जगह पर पहुंचूंगा. दैट इज अ डे 5 एम्ब्रियो जो है वो रीच करेगा द यूट्राइन कैविटी. एंड इफ एवरीथिंग इज फेवरेबल, इट विल इम्प्लांट, मतलब वो वहाँ चिपक जाएगा, वो वहाँ घर बनाएगा, इट विल स्टार्ट ग्रोइंग, मल्टीप्लाइंग, एंड इवेंचुअली इन 9 month पे एक हेल्दी हमारा बेबी होगा. Now, in IVF, it is basically we are trying to replicate all this outside the body. So before we get there, it is like, when should I know that I need to go ahead and have an IVF? So इसमें पहले आता है कि how do we undergo an infertility evaluation? So अगर 1 year तक आप कंसीव नहीं कर रहे हो, if you're older than 35 years और आपको 6 months हो चुके हैं, या you are more than 40 and you're thinking of pregnancy, that is when you should meet your fertility expert. So a basic gynecologist can only help you screen, but if you're looking for a further treatment, a more specialized treatment, you should meet a fertility specialist. And if men have any concern regarding their fertility, they should meet an andrologist. वो डॉक्टर्स होते हैं जिन्होंने स्पेशलाइज किया होता है मेल इनफर्टिलिटी में, और a urologist. And if in case आपके पास उनको access नहीं है, you can meet the gynecologist who can guide you further. सो नाउ IVF and ICSI हमें पता चला दैट इज एन असिस्टेड रिप्रोडक्टिव टेक्निक, जिसमें हम बाहर सब कुछ कर रहे हैं. उसके कॉम्प्लेक्स प्रोसेस है, लाइक इट हैज मल्टीपल स्टेप्स. आज हम उन्हीं को सिंप्लीफाई करके अंडरस्टैंड करने की कोशिश करेंगे, सो दैट when we are into it, we know what to anticipate and expect. So before we get into it, हमें है कि who needs an IVF? Because general myth होती है कि okay fine, let me try everything. If nothing works, if मैं अपने fertility potential के fag end पे पहुंच रही हूँ, I'm crossing 35, 36, that is when मुझे IVF की ज़रूरत है. उससे पहले I can conceive naturally. सो अगर आपके पास आपको कोई प्रॉब्लम है फर्टिलिटी की, अगर ओव्यूलेशन की प्रॉब्लम है, एग्स नहीं बन रहे हैं, और आप मल्टीपल ट्रीटमेंट्स करा चुके हो, आप 6-7 months के लिए ओव्यूलेशन इंडक्शन एग बनने वाली मेडिसिन ले चुके हो, 3 बार IUI करा चुके हो, एंड इफ देव नॉट वर्कड, दैट इज व्हेन यू नीड टू टेक the help of assisted reproductive techniques in the form of IVF and ICSI. Now, the concept that the later we do is going to be helpful it is wrong. It is the sooner we are into IVF, the better outcome we get. अगर किसी पेशेंट की ट्यूब्स में ब्लॉकेज आया हुआ है कि दोनों साइड की ट्यूब ब्लॉक है और हमारी एडवांस्ड एज है विद एनी अदर कंट्रीब्यूटिंग फैक्टर, या हमारे एग रिजर्व्स आर वेरी लो and we've tried initial evaluation and initial treatments which are not working, या हमारा कोई जेनेटिक फैक्टर है, से फॉर इंस्टेंस थैल माइनर है दोनों हस्बैंड वाइफ में, यू वांट टू रूल आउट थैलेसीमिया इन आस, जो ऑफस्प्रिंग है बेबी में थैलेसीमिया नहीं होना चाहिए, हम वो रूल आउट करने की कोशिश कर रहे हैं. सो दैट इज व्हेन वी need the help of genetic analysis. So these are the reason where we have to go ahead with assisted reproductive techniques in the form of IVF and ICSI. Males में अगर sperm count is very low, sperm functions are abnormal in the form of very low motility or morphology poor है, और sperms नहीं है, हमें टीजा टेसे माइक्रो टेसे करके हमें sperms retrieve करने हैं, or there's something which is affecting the deposition of sperms, maybe some structural abnormalities, so they can help, IVF can help us in those cases. So now after the initial evaluation, अब आप IVF के लिए आते हो तो what is it basically? तो first is आपका एक initial evaluation होता है with your fertility expert regarding your detailed history. Your detailed history में everything regarding your medical health, your menstrual history, कोई आपको abnormal bleeding होती है कि नहीं, any hormonal disorders that you have. That holds true for both the partners. Husband, he detailed history regarding his work exposure. Occupation is important because any exposure to chemicals in your workplace can significantly affect your reproductive potential. Any medications that you've been taking over the counter, कोई हम herbal medications लेते हैं, people take something for their hair growth, something for like general health, they can also have an impact on your fertility. If somebody is into excessive gymming and are taking supplements in the form of testosterone, they are going to negatively impact on her fertility potential. History regarding what are the illnesses that run in the family, अगर कोई genetic disorder है जो हमारी family में run करता है, कोई birth defect है which can impact us, they all need to be evaluated initially. आपकी lifestyle is a very important. If you have a sedentary lifestyle, कोई addictions है हमारे, कोई प्रीवियस हमें सेक्सुअली ट्रांसमिटेड इन्फेक्शंस हो चुके हैं, और एनी difficulty during the consummation of the marriage or the sexual activity, these are all very important. So now when you come for a basic evaluation, what are the tests that we do? So the tests, जब आप IVF के लिए आते हो कि IVF में हमें enroll होना है, or whether when the doctor says you might be needing the help of IVF or ICSI, we go ahead with a laboratory test and the imaging test. Lab test में हमारे आएंगे simple blood test like your basic hemoglobin, your hemoglobin electrophoresis to know आप thalassemia minor के carrier तो नहीं हो और sickle cell के carrier तो नहीं हो, your hormone profile in the form of thyroid, prolactin, your sugar levels, your viral markers, these are, and often obviously your egg reserves, your serum AMH, your rubella vaccination status. Now rubella vaccination बहुत लोगों को नहीं पता होता है. You're going ahead with fertility treatment, but rubella is a very common viral illness which is very prevalent in young age group. And as a part of the Indian vaccine schedule, हमारा immunization schedule for the pediatric population, MMR vaccine against rubella is given at the age of 9 months. But a few years back, maybe 20-25 years back, वो हमारे schedule में नहीं थी. Now, why are we talking about rubella? Is because agar you get exposed to the rubella virus during the first 3 months of pregnancy, it can have some permanent damage on the baby or on the fetus. This is sensory neural hearing loss. So these are all the tests that are conducted. Apart from that, imaging test in the form of an ultrasound, a transvaginal ultrasound, वो हमें idea देता है how is the uterus, how is the endometrial cavity, how are the ovaries, what are the egg reserves, any associated pathology, adenomyosis है कि endometriosis है, PID suspect कर रहे हैं, hydrosalpinx है, ovaries का reserve कैसा है, कोई cyst है, everything, this information can be garnered with the help of an ultrasound. Now men also need an initial testing. Now for men, often like semen analysis is a very comprehensive test. So apart from a few blood tests like thyroid, prolactin, the viral markers, We go ahead with the semen analysis. जो semen analysis हमें idea देता है कि how are the sperm functions, what is the number of sperms, the concentration, उनकी motility, उनका चलना, उनकी morphology. And if in certain people जिसमें indicated है, the parameters are altered, we might go ahead with a further hormonal assay depending upon individual case to case basis. Now, if in case depending upon your lifestyle, if you have exposure to chemicals or a lifestyle which is not very unhealthy, or we're expecting some DNA damage, we can go ahead with further testing in the form of a DNA fragmentation index. If needed, if the reports are not normal, an andrologist consultation is ideally needed during the IVF, who can rule out any other abnormalities in the form of a varicocele, a hydrocele, any infections, and guide us further. SOS, as in when needed, an ultrasound can be done to guide us further if there are any positive clinical findings. So women के we've covered all the tests. So apart from the initial test, जो हमने सारे hormones and blood tests discuss किए, apart from that, some women might need hysteroscopy or laparoscopy before the start of the IVF procedure. Now, how do we decide who needs it? Now, अगर किसी lady को major endometrioma है or severe endometriosis है which is making हमारी ovaries को inaccessible मतलब उन ovaries में egg grow होंगे but the endometrioma is so big कि वो हमें उस ovaries को reach करके egg निकालने में hinder करेगा. So that is when we would want कि we go ahead with a laparoscopy first, remove the endometrioma and then go ahead with the conception. अगर कोई major hydrosalpinx है या हमें किसी की 3D ultrasound if we are suspecting some uterine anomalies, that is where a hysteroscopy or laparoscopy might be needed before the procedure. So these steps of IVF, if you can see, I've written some 6-7 steps here. So अभी ये हमें टेबल देख के बहुत ही वो jargon लगेगा कि what is it? It does not make any sense. At the end of the presentation, we'll have a look again at this image, and then everything would make sense hopefully. So now, क्योंकि अगर हम देखें हमारी नेचुरल साइकिल में क्या होता है, हमारी नेचुरल साइकिल में एवरी मंथ डिपेंडिंग हमारी जो साइकिल लेंथ है, हमारा एक एग जो है मैच्योर होता है, ग्रो करता है, एंड देन इट इज रिलीज. Now, IVF cycles में we are just trying to magnify it. We are going in ovarian stimulation हमें करना है to maximize. So now how does this work? So we can consider it as every second day of the period, first second day of the period, आपकी ovaries बिल्कुल baseline पे होती हैं. Depending upon what your egg reserves are, ovaries अपने अपने right and left side पे there would be intral follicles जो hormones को receptive है, which would respond अगर उनको hormones मिलता है, and they can grow further. So now, depending upon the number of eggs that your ovaries shows, which in turn depends आपके AMH के ऊपर, you are given injections. Now, ovarian stimulation बहुत अलग-अलग protocols हो सकते हैं, different types of stimulation हो सकते हैं. So depending upon what is your age, what is your BMI, what is your previous history, previous आपने fertility जो treatments कराए हैं, previous IVF अगर आपने कोई कराया है, what was the outcome, what was your body's response, any associated pathology like endometriosis या कुछ और है साथ में, the fertility specialist आपके लिए एक device, हम आपके लिए एक plan device करते हैं कि which protocol will work out best for you. So it ideally starts before the stimulation cycle, जैसे जिसमें सारा evaluation हो गया है, हम usually pre-treatment देते हैं. When you get your periods, on second day of your periods, एक baseline hormonal levels कराते हैं so that we know that everything is down regulated and your ovary is ready to start afresh and work full throttle. So depending upon your case profile, your protocol is decided and injections की dose decide होती है. तो injection की dose decide होने पे you are administered injection. Now these injections would be given almost around a fixed time for 10 days, which can be plus minus 1 to 2 days. So on second day of your cycle, आपका injection start होता है. After 5 days of injections, your एक scan होगा to reassess आपकी ovaries का response, how many follicles are responding, what is the size, any dose changes if required, addition of another injection as and when required. So now this goes on for 10 days. with beach में where we reassess your ovaries and your response so as to titrate your dosage. Now, on an average, a woman would need 10 days of stimulation. But then again, I said it is plus minus 1 to 2 days depending upon an individual's response. So we have different injections. We have a recombinant FSH, recombinant LH. We have highly purified human with HMG. We have urinary HMG, urinary FSH. Different injections. जो आपके individual case के लिए best होगा, that is what we decide which will work out best for you. So after having 10 days of injection, the growth is monitored with the help of a transvaginal ultrasound. When we feel that the follicles are ready, clinically on an ultrasound by different parameters, size is one parameter, the blood flow to the follicle, we compare it with the blood hormone level, the blood estradiol level के साथ उसको compare करते हैं, and an IVF trigger shot is given. Now trigger shot is something that would have the final maturation of the egg, कि eggs हमारे final mature हो, and help us schedule your pickup. So now triggers can be again of different types. We can have an HCG trigger, जिसमें सिर्फ urinary HCG और recombinant HCG देते हैं, or an agonist trigger in people जिसमें बहुत the ovaries are hyper responding, जैसे PCOS patient, जिसमें we are expecting more than 15-20 eggs and we fear OHSS हो सकता है, और a dual trigger where agonist plus HCG हम दोनों ऐड करते हैं and they help in getting a better quality of eggs. So, and every trigger has a different duration. कि HCG trigger है तो we'll have a pickup 36 hours later, agonist है 34 hours, dual 35 hours. So the trigger is administered once the doctor feels कि आपका follicle ठीक है, corresponding E2 levels are okay. And then after the trigger, after that scheduled time, आपका oocyte retrieval होता है. Oocyte retrieval is taking out those eggs. All those eggs जो आपके ovaries में ready हुए हैं, we try to take them out. Now, how does this oocyte retrieval happen? Now, oocyte retrieval is a procedure that is done under a short general anesthesia or a total IV anesthesia. Now, it is a 10-15 minutes procedure. Most commonly, हम इसको transvaginally करते हैं. So, transvaginally is like if you have had a transvaginal ultrasound, the probe has a guide जिस पे oocyte retrieval needle attached होती है, as you can see. And with the help of ultrasound guidance, we retrieve the follicles and they are delivered to the lab. In certain cases where the ovaries are not accessible vaginally, a decision for transabdominal oocyte aspiration can be taken. So both can be done. The oocytes are taken out and then they are analyzed in the lab. After a series of steps done on the oocytes, कि हम उसका highlights करते हैं, they are reassessed for all the mature oocytes are separated. उन mature oocytes में ICSI होता है. Now ICSI is basically, as you can see, egg के अंदर हम एक particular sperm inject करते हैं. Now, how does this sperm selection done? Now, there are different methods for sperm selection. The basic ones is like we prepare and the sperms are further assessed morphologically with the help of by the embryologist, and the best sperm is selected and injected into the oocyte. They can be advanced like MAX, magnetic assorted cell sorting, or it can be microfluidics also. So these help in selecting the better sperm qualities, which can be used for ICSI and improve the outcome. जब ICSI हो जाती है, उसके बाद they are cultured in the lab to grow further. Now, when they grow further, if you see the bottom wala, they are assessed. They can be continuously assessed with the help of a time-lapse imaging where we are continuous monitor, or next day for fertilization and then a day 3 check. So now agar aap sunoge, there are two embryos that everybody talks about, a day 3 embryo and a day 5 embryo. So a day 3 embryo would be like this, on the right side the 8th cell stage, and a day 5 would be a blastocyst. Now whether to go ahead with a day 3 or day 5 transfer, ideally, technically, abhi, as per all the international guidelines, we go ahead, we prefer a day 5 transfer if you have a good lab. And day 3 or day 5 is a decision that should be taken between the treating doctor and the patient. Ideally, it is a day 5 embryo transfer that it is done. A single day 5 embryo is the preferred one by us. Now these embryos are further graded depending उनकी cells जो है उनकी size कैसी है, कोई fragmentation है कि नहीं है. So now this is something your doctor informs you कि आपके जो embryo बने हैं, how do they look, what is the grading, how is the quality. Now this predicts हमारे लिए the success rate. Now the good quality of embryo would give us a better success rate in terms of pregnancy. Once the embryos are made, the transfer is supposed to happen. Transfer मतलब अब ये जो embryo हमारे ready हो गए हैं, how do we place it and when do we place it inside the uterus? So there are two types of transfers. Now one is आपने सुना होगा there's a fresh embryo transfer and a frozen embryo transfer. Fresh में जिस दिन आपका oocyte retrieval होता है उसी दिन आपका progesterone start होता है and on fifth day the embryos are transferred inside the uterine womb. On in a frozen embryo transfer cycle, ये जब embryos बन जाते हैं day 5 पे they are frozen and then in your next cycle you're given medicines to prepare the lining of the uterus and then the transfer happens. Now how do we say which is better or not? So there are many positives and negatives. So now the frozen embryo transfer has given us a better success rate in cases where it is endometriosis है, PCOS है, या at the time of trigger progesterone levels high है. It is very much safe in cases of patients who are a higher propensity for OHSS. And those who want to go ahead with the genetic testing of the embryo, frozen embryo transfer permits us with that. Now the only concern here is as compared to a fresh embryo transfer cycle, birth, जैसे हमारा births associated preeclampsias and larger babies, they are or little on the higher incidence. But that can be mitigated with the help of a different transfer protocol in frozen transfer cycle. In fresh transfers, it is obviously it has a lesser time durations because the time to transfer is less. It is done only during the OPU cycle only. But the only concern is there's a higher chance of OHSS risk in these patients. So you discuss it out with your treating doctor and a decision can be taken regarding fresh versus frozen transfer. Additional steps that might be needed in an IVF cycle is whether or not you go need a genetic testing depending upon your history. In case of previous failures, do you need to assess the endometrial receptivity? Any added investigations if you've had previous implantation failures, or hysteroscopy and laparoscopy SOS when required. In case of people with multiple fibroids or adenomyosis, there might be a gap taken, a break between the oocyte retrieval and getting the uterus a little in control in the form of reducing the volume of the uterus with the help of either Mirena or loop, right, so that the outcome is better. So the additional steps that might be required in an IVF or ICSI cycle might be explored in discussion with your particular case with your fertility expert. That's it. Thank you so much. And now that we go through with this image, you can see now this shows the step 1. Now we have the ovulation induction. Step 2 is the trigger. 3 is when we take out the eggs. 4 is the ICSI. And these eggs are then cultured. Those that make to the day 5 are eligible for transfer. And step 6 is the embryo transfer, which can be either fresh or frozen transfer. And once the transfer is done, within 14 days, we can have our result of pregnancy. Thank you so much. Any questions? Which embryo is best for IVF? I think your question might be a day 3 versus day 5. So a day 5 embryo or blastocyst transfer is considered best for IVF. What should I have to avoid before IVF? So before you go into IVF, it is very important that you avoid any smoking, drinking that you're undergoing. You get an adequate BMI, ideal weight range is very important. Any hormonal abnormalities that have, if your sugars are high, if your thyroid is not under control, they need to be regulated before you start with the IVF cycle. You need to have your pre-medications in place, all the antioxidants, supplements, and the pre-treatment needs to be done. The complete duration of IVF, if we are talking about a fresh embryo transfer cycle, so in that case, it is 1 month. If you're talking about a frozen embryo cycle, it is 2 months, depending again on the individual patient. Thank you so much. I hope I could help you out with understanding the IVF procedure in simple terms. So if you have any queries, please feel free to contact us at the given helpline number. This is Dr. Poornima Mathur from Oasis Fertility, Vadodara. Thank you.